Welcome to the Voice of Good morning and welcome to the Voice of Business podcast. This is Tish Williams with the Hancock Chamber of Commerce, and we are broadcasting live from the top of the Hancock Whitney Bank building in beautiful downtown Bay St. Louis. And today we're going to focus on an update from Memorial Hospital at Gulfport. We have a guest host today, Ms. Nancy Depreo, the mayor of the city of Diamondhead, and she will be interviewing our special guest, Chase Pierce, the Vice President of Business Development for Memorial Hospital at Gulfport. So if you're listening, if you're on Zoom and you want to ask some questions later at the end of the interview, just raise your hand and we'll bring you live into the podcast. And if you are watching us on Facebook, you can just drop your questions into the comments section and we will bring your questions to our special guests. So without further ado, please join me in welcoming the mayor of Diamondhead, Nancy Depreo. Good morning, Nancy.
Good morning, Tish, and good morning, Chase. Thank you both. Good morning. What a beautiful morning we started out with as well, right? First day, it felt like fall. Excellent temperatures. Beautiful. Chase, I know we're going through right now the recovery of Hurricane Ida. You know, the coast was very blessed. We had very little damage. We are assisting our neighbors to the west, Louisiana, as much as we can. And in the midst of all the Hurricane Ida, we're forgetting about COVID. And I know Memorial Hospital has been in the front line. Y'all have been working endlessly with the battle with COVID. We saw the month of August was the highest numbers that we've had in the state. We broke records many times daily. What is going on at Memorial currently now with COVID? How do you see the numbers and where do you feel we're heading?
Yeah, so the last 4 to 6 weeks has been extremely challenging for the organization. You know, back in the beginning of August, we knew this fourth wave was coming, and each week we'd look at the numbers and be like, oh, we broke records, and we were hoping that that would be the end of it. But by the third week of August, fourth week of August, we really hit the peak. And when I say hit the peak, we're talking about 300 plus positive cases a day through our health system. We were testing over 800 people a day through some of our drive-through lines. We would have upwards of 100 COVID positive patients inside of our hospital. So if you think about all that and all the resources that are required to take care of the COVID patients, it really pushed us to a limit. Thankfully, we've seen that downward trend now. As of this morning, we're in the 40s for COVID patients inside the hospital. You know, so that's a very positive number. What we're seeing per day right now on positives, somewhere around 70 to 80 per day. Now, every now and then we'll see a spike where it's 120 or something like that. But just to put that in comparison, we're saying that's low right now, right? We think that's we're going down and we can take a breath. Just remember that in January, during that third wave, the most we ever had in one day was 131 positive cases. So if you take January, and we were totally stressed out then, we're still at that point, that January, what we saw in January. So we are not out of the woods yet. One of the things that we've done that I think has really saved a lot of hospitalizations is our monoclonal antibodies. Right now, we can do up to 200 infusions a day on that. And really the process for that is if you test positive, you meet the eligibility, our system will give you a call and ask if you would like to take the antibodies, and we get you in and out pretty quickly within a couple of hours, and we see a lot of positive results out of that, and really helps us keep patients out of the hospital. So
but you just opened up a new center to be able to.
That's right. So about 3 weeks ago we could do about 120, and then we opened up a new center there in what we have as our fitness center. We moved some of our equipment out, and it's just a large open space, and we're able to just do close to 200 a day now.
Wow.
So with the antibody infusion, and we know that has made a tremendous tremendous impact on recovery. What do people need to know about the timing once they test positive? And if they test positive at a facility, let's say not Memorial Hospital, are they allowed then to call the hotline at Memorial Hospital and get set up for antibodies? And what is the timing required from the time that they are diagnosed with COVID, test positive, to when they need to reach out to Memorial Hospital and get set up with an appointment for the antibody infusion?
Yeah, so if you test positive anywhere, you can call the 5000 hotline, 867-5000, and request it. It doesn't have to be only through Memorial positive. What happens then if you test positive through Memorial, our team has that positive result and they will actually reach out to you. But if you have a positive result from somewhere else and you want to get the infusions at Memorial, you can call the 867-5000 number. We can get you in. It's not from diagnosis days, it's from symptom onset. And so you have to be no more than 5 to 7 days from symptom onset to get these antibodies.
Okay, so if you start feeling symptomatic, you wait 3 days to go get tested, you test positive, that started your 3 days from the countdown of when you should get the antibody infusion.
That's right. So you've already been 3 days in. So you have to get that antibody within, 2 to 4 days.
What is the rate that you're seeing on the percentage of folks that get the antibody infusion as far as their recovery time?
We usually see the symptom onset decrease. We don't really keep up with that statistic, and it's hard to really keep up with the hospitalizations, because who's to say if they would have got this or not got this, would they have been hospitalized, right? So it's hard to say how successful it is on a true number, but what we know for a fact is that we see people get better quicker, and we know that those people are not getting hospitalized as much. We know that. It's just hard to put numbers on there.
All right, thank you. And so you're seeing a trend down right now from our 4th wave of COVID. Is the ICU facility, do you see that an impact there right now, or people on ventilators? Has that been reduced? I know you all were working nonstop through the month of August, trying to keep that going and help everybody that you could. Is those numbers getting less now on the ventilators?
I can tell you that the hospital is still full. And what you see with COVID patients, especially this Delta variant, is that these patients that are hospitalized have a long length of stay, meaning that they're taking up beds for a long time. Once this patient goes on a ventilator, it's a very long time, and they're not likely to come off the ventilator. The survival rate once you go on a ventilator is very, very low, and you can stay on that ventilator for weeks. And so that's what we're seeing today, right? Is that those patients that are on a ventilator have been in the hospital 3, 4, 5 weeks, and it keeps the hospital full. We are still full. We do not have any ICU beds right now. We do have some med-surg beds available, but very little. The majority of the time, we have 0 beds available throughout the hospital, and we're holding patients at all times in our ER. I think we started the week, or on Tuesday actually, we had almost 30 ER holds in our ER, waiting for beds into the hospital. So we are still extremely full. The ventilator status, we did receive some ventilators from the state. So we are okay with ventilators at this time, but it's always something that's on our mind, because it can change in just a blink of an eye. It really can.
Nancy, we were talking earlier before we went live about the contract labor that MEMA is bringing to hospitals throughout Mississippi, and Gulfport Memorial is about to get help on the way.
Yeah, so we hope we still are hoping to receive nurses from the state that can work in our inpatient setting. I think that a lot of times people think they can just, they're going to send nurses. Well, you can't just send nurses without training, right? You got to train them on our software. You got to train them on our processes. And if there's a short amount of time for these nurses to be in at our facility, let's say 6 weeks, then it's very hard to train them on our ICU system, right? So we have to have very experienced nurses coming in so that that training period is reduced. They can get to work and really start helping us. So that's what we're waiting on right now. The state is still telling us that we will receive that. So we're holding out hope.
All right. What is the most important message you want to get out to people about COVID and where we are right now and what they can do?
I think it's the most important message is it's not time to let our guard down. We will feel like COVID is going away in this area over the next couple of weeks, but rest assured that it's not going away. It's just getting better for right now, right? I think that if you choose to get the vaccine, we can get that for you. That is a personal decision that everybody must make. I personally recommend it for anybody that is eligible to get it. I think it does help in many ways, but at the end of the day, you have to do what's best for you and your family. I think that we need to make sure that we continue wearing masks around the appropriate people. And then the biggest thing really is if you have questions about COVID, ask your primary care physician. Get out there and talk to them, and not just listen to all the different messages that you'll find on social media, on different news networks. Really get to your professional, your primary care physician, and ask them the questions that you have.
Excellent, thank you. And the City of Diamondhead, through your support, Memorial Hospital, will be hosting a vaccination clinic on September 15th from 8:30 to 3 p.m. And the second dose will be October 7th, administered at City Hall in Diamondhead. We'll have the activity room set up. Folks can call the 228-867-5000 hotline number, set up an appointment, or walk-ins are available, as well as we had a few residents ask about the booster and vaccination, if they could get that while they were here. And if you are considering doing that, Memorial has asked that you bring a prescription from your doctor. And just like Chase just said, talk to your doctor, reach out to them. So if you're looking to get the booster on September 15th, you need a prescription to get it, but you can get it if you have a prescription.
So who's eligible for the booster?
People with immune compromise, and I'll let Chase answer that. I didn't mean to step in and be the medical, but I think that's where we're headed.
No, that's fine. Yes. So it's anybody that has a immune compromised condition. And really, even at that point, what Memorial's doing is that we're asking them to come with a prescription from their primary care physician to make sure they're meeting that requirement. The booster is something that is available, but the CDC is still looking at the effects of it. They made it available, but we want that note to come, that prescription to come from their provider.
It's not open to all yet.
It is not. It is not like the first or second dose vaccine. There's not a standing attestation for the booster right now.
All right, thank you, Chase. And we are also excited. Thank you all assisting Diamondhead with having that vaccination day. Last time we had it in Diamondhead, we had people lined up, and I forget how many, but it was several hundred vaccinations you all did, the first and second. People came forward and got vaccinated. We're very excited also about Memorial's Hospital, your new expansion here in Diamondhead, the 20,000 square foot facility, which is going to bring new medical options to Hancock County that we haven't had from Memorial. We're very excited, not to mention new jobs, tax revenue increase. You're bringing a lot with it, and you're also bringing a catalyst for future medical facilities to come in. So would you like to brief us on this new 20,000 square foot facility Memorial's bringing?
Yeah, absolutely. I'm extremely excited about this facility. It will be the largest freestanding clinic that Memorial has. It is going to have the most services that we will provide at a freestanding clinic. Like you said, it's going to be 20,000 square feet, of which the first 17,000 will be the actual clinic space. We will leave about 3,000 of that open for potential expansion, depending on what we want to do with that. Like you said, one of the biggest things that are going to be a benefit to the community and the services that will be new will be the infusion chairs. We will bring 4 to 6 infusion chairs to this clinic. This is something that will be a first for Diamondhead, a first for our Hancock County for Memorial. This is for chemo. It can be for any other infusions like CHF infusions or any other medications. The monoclonal antibodies, those are infusions. They can be done in these chairs for COVID. So it's something that will change the whole community in a very, very positive way. I think that anybody that has gone through chemo or an infusion in general, having to drive 30 minutes after you've had that infusion, that is tough. That is very, very tough. So to be able to bring that to a community like Diamondhead, I believe it's going to be a complete game changer. I also think that we are going to offer first time ever in Diamondhead what we call our remote patient monitoring. That is a form of telemedicine. We actually are offering that today through Dr. Kellum, his office in Diamondhead. But remote patient monitoring is a form of telemedicine that the patient will take home a pulse ox or a blood pressure cuff, a scale, a thermometer, and then they take that home with a regimen saying, okay, you need to take your blood pressure every 4 hours or every 6 hours. And that loads automatically up into the cloud. And that information comes back to somebody, a clinician that is watching that. If there is something that is going on, they will contact the patient. But most importantly, it gives us trending data for certain clinical information. And that really helps the provider to care for the patient in the best way possible. So that's new. And that is the first time that we're offering that through Memorial at any location. And that's going to be offered right there in Diamondhead. So that is also new. So those are two of the biggest things, right? You know that right now in Diamondhead Memorial has X-ray, has bone density screenings, has mammograms, has CT and full lab services. All that will go over to the clinic as well. So those are the two big things, right? We'll have primary care there, taking up about 6 exam rooms, and then we'll have anywhere from 4 to 6 exam rooms for rotating specialists. That will be neurology, neurosurgery, cardiology, endocrinology, pain management, and then of course oncology. The new services that will be going out there: GI, wound care, and urology. So all of those services will be at the new clinic.
Excellent. I can't thank you enough. I mean, the residents are going to greatly appreciate this. And as you mentioned with the infusion center, this will be the first time in Hancock County we've had that availability of the infusion center north of I-10. You know, many residents in the county drive over to Memorial Hospital, and as you mentioned, it is difficult to get back after getting an infusion, whether it be chemo or one of the others. So we greatly appreciate that. Bringing in the specialties, this is phenomenal. Thank you. Different areas, and we're excited to be the first with the monitoring. Excellent, yep. Excellent asset with that. So
Mr. Mayor, Madam Mayor, location. That was one of my questions. If you don't live in Diamondhead, you might not know where this is located.
Right. So, Chase, you want me to answer that, or you want to?
Hey, look, I'm happy to answer. Look, we're going to throw up a picture here, and this is a kind of a bird's eye view of where this clinic is going to be located. You'll see here, there's Veterans Drive on your left, and to the south is East Aloha Drive. So if you're not familiar with Diamondhead, that is, take the Rouses, and if you take that road past Rouses, you'll run into Veterans Drive, and it will be right there on that corner. You can go by there today, actually, and the steel frame is going up today. You can see it, it's there. It's going to be in a beautiful location. I think that it's going to add a lot to Diamondhead, and we're super excited about it.
And it is big. I see the expansion space you have to the left, and I know there was talks about putting in a pharmacy there. Is that still something Memorial's looking at?
So yes, the talk is still for a pharmacy. We still are working through the contract for that, but that is our thought at this time, yes.
All right, excellent, thank you. And with that, you know, I did hear in the forecast, and this is our first TIF funding. So the city of Diamondhead is very excited to work with Memorial on the first TIF funding project in the city of Diamondhead. It's anticipated that you will bring in between 60 and 75 part-time and full-time jobs. Is this still anticipated?
That's correct. You know, what we see today, and I'm going to speak to our actual employees that will be into the clinic. And we can speak about the construction jobs creation at a later time too, but right now we employ about 35 people at that clinic. We expect that to increase to north of 50 for the services that we will be providing. What you see in the infusion chairs, for each one of those chairs, there is a revenue creation of somewhere around $2 million for the community, for the clinic. Now, that is just the revenue for the chair. That doesn't take into any account for the cost or anything like that. So if you do 6 chairs, what is that? You know, right at $12 million a year, that additional money's coming into the community, coming into the clinic. So that's something that, you know, we know will be a revenue driver and increase revenue for not only Memorial, but for the county.
Excellent, thank you. And the infusion chairs, you all positioned them facing the rear out to the wooded area that's behind that, and we know that'll be a great view for folks that are sitting in those chairs getting infusion while they sit there and wait for a few hours, you know, to get their infusion completed. Also 20 exam rooms. So this is how much bigger is it from the current facility we have there in Diamondhead? That's a lot of exam rooms, 20.
So right now we have usable exam rooms right at 13 at the Diamondhead Clinic today. We do have 20 exam rooms at this new location, and our hope is that all 20 will be full every single day. And we will work towards that. You know, we have primary care physicians that will be there every single day. We actually just had a new primary care physician start out there, Dr. Fowler. So, you know, he's new to the system. Wonderful doctor. I think he's going to be very successful in that community. So if y'all are looking for a primary care physician, Dr. Fowler is available there in Diamondhead.
Okay, so we can just reach out to the Memorial main campus and get his number and be able to call and get appointments set up. So the residents are driving by and we're all excited. Everybody passes by in their golf carts daily or their cars watching the progress. Do we have an anticipated grand opening date?
Yeah, so a lot of work to be done, but what we're looking at is probably a summer to fall of 2022. So that is anywhere from 9 to 12 months. We hope to be completed and seeing patients over there.
Excellent. So we can look forward to the fall being able to have it open and ready to move with patients in there. Well, thank you.
That's correct. Yep.
Thank you very much. We're excited to have you all here again, investing in Diamondhead. Look forward to seeing it completed.
So tell me, do you believe what we've talked about today, will that meet the needs that you hear for your city? Is there anything else that we can do?
we reached out to our residents, and looked at specialties that were needed. So all the ones that you called out is exactly what we need here in Diamondhead, and not just Diamondhead. We're looking at the county collectively. These are type services, some of which we haven't had offered here. So these are definite needs that we have in our community. And the residents will deeply benefit from everything that you all are bringing, especially having the specialty doctors come in and be able to come here to Diamondhead without the residents having to travel to Memorial Hospital or other facilities in Harrison County. So definitely, this is definitely what we needed, and we thank you.
What we try to do at Memorial, and we say this a lot, and you probably hear it a lot, but we want to deliver care to our communities, right? We don't see any reason why our residents that we serve have to go long distances to get care. That all started with, they shouldn't have to go to New Orleans, or they shouldn't have to go to Mobile or to Jackson. And so what can we do to keep our residents here in their homes, where they can go back home each day, if that's something that can be done. But also, just to your point, from Diamondhead to Gulfport, that's a long drive. And so anything that we can do to keep the community, keep the residents in their community, and we bring the care to them. That's what we want to do. That goes along with the remote patient monitoring as well, and the telemedicine. We want to be able to have the patients go where they want to go to receive care, not where we tell them to go, right? So that's good to hear that we're meeting the need there, and we're excited about it.
On the remote patient monitoring, is that something that the residents can go ahead and get with the two physicians you have here, Dr. Kellum and Dr. Fowler, and get it initiated? Or do they have to wait till the fall of 2022 in order to have this availability, which I think is a tremendous asset?
Yes, so you can go ahead and do that today. Dr. Kellum's office has that available today. And the way that works, it's called Renova. Renova has, we actually have an employee inside of the clinic that does nothing but the remote patient monitoring. Dr. Kellum will prescribe that. So it has to go through Dr. Kellum at this point. We will offer that to Dr. Fowler in the coming months. But this is something that we're very excited about. And so if anybody's interested in that, please reach out to Dr. Kellum to establish care, and then he will take it from there.
All right, thank you. And looking at it from the city standpoint, construction wise, you're bringing in a lot of construction jobs. You're bringing in a lot of sales tax revenue with construction workers eating and visiting our city of Diamondhead. But also you're bringing in a lot of sales tax with the facility once it's opened, and a big investment. Do you have any projection on what those numbers are?
I don't have numbers that I can share with right now. I can tell you that from a clinic standpoint, we hope that we can generate anywhere from $4 to $5 million in revenue per month, which will cover our costs. And we're not there to make money. It will cover our costs. That's what we want to do to break even. If we're breaking even there, then we are being very, very successful. So I think that from a number standpoint is something that I'm not able to share with right now. We still are 9 to 12 months out, but that's where we believe we need to be.
Excellent. And I think with the pharmacy added on, you'll far exceed where you're predicting you will be.
Agree.
Definitely. Okay, with that, I am going to, did you want to add anything else about the facility?
I think that I want the residents of Diamondhead to know that drive by there, look at it. I think you'll see, it's impressive to see the size that it will be. Like I said, it's the largest facility that we're going to operate, freestanding clinic that we're going to operate. And it has so many services, and it has increased parking, which is an issue at a lot of the places, right? So I'm just excited about it and ready to get it open. And I hope that the residents there in Diamondhead are excited about it. Not just that, but like you said, for anybody in North Hancock County, north of the interstate, this facility is for them. Even in Bay St. Louis, you know, the drive over to get infusions will be a lot easier as well. So it really is a facility for Hancock County that we're super excited about. And I want the residents to be excited about it as well.
Thank you, Chase. We're very excited here in the city of Diamondhead to see it going up, and we're watching the progress daily, anticipating the fall of 2022 so that we can start getting our residents in there, seeing the many specialties that you will have in there. So
Yes,
I'm going to
yes.
turn this back over to Tish and see if we have any questions.
Thank you, Mayor Depreo. That was a very informative session, and we do have some questions coming in. I think one of the things that I'm most excited about as the chamber director is all of the spin-off value that this new facility is going to generate, that the mayor pointed out, the new businesses that could be developed as a result of this catalyst, this economic catalyst, the jobs, the sales tax diversions to the city that will help fund more services for residents. So it's just a win-win for everyone. And the mayor talked about TIF financing that helped make this possible. Mayor, I'm going to direct a question back to you. There's a question that's come in. What is TIF financing? What does that mean? And how did that support this project?
So tax increment financing is something new to the city of Diamondhead. It allows developers, big developments to come in. And what we do is tax increment financing. We post a bond with no cost to the residents involved in anything, from the advertisement of the bond to the initiation of the bond. All of these fees are included in the bond, and the city is paid first from the bond. So what we do is we use the taxes that are based off of the new facility coming in. We use part of the sales tax revenue. We use part of the property tax revenue to pay the bond over a period of years to pay back the amount that we funded. And I believe on this one, we were a little over 500,000 that we posted the bond for. And that was used for construction. So different parts of the construction, this facility was placed in an area that we were lacking certain utilities, water, sewer. Memorial Hospital came in on the development, spent extra cost putting in these utilities and infrastructure for the utility district that we can use for the future. That will be a catalyst to let that area even be developed more. And these are the type items that were used in the bond covered to help make this development possible.
Right, and as a result of having that facility right there where it's going to be, where it is located, it's already under construction. There's room for expansion for other businesses to move in.
That is very true.
Correct?
So we're hoping that this will be a catalyst for other medical offices to come in, you know, and have different opportunities available for the residents.
So another question that just came in is, what about the current facility that is there in Diamondhead? Is it going to remain operational?
Yeah, so that the current facility will move out of. That is a lease that we have. So the owner of that building will be able to lease that out to other businesses as well.
So another new business opportunity. And we have some more questions that have come in from Facebook Live. Right now, from Myra says, right now, blood tests aren't done in Diamondhead. Blood is sent to Gulfport to process. Will the new facility be able to do their own testing?
So we will have to continue sending those blood tests to the main campus. And that's for several different reasons. The first reason is the equipment that processes that for certain tests is only at our main campus. We will be able to do our point of care services and labs. We will process those specimens on site, but a lot of the blood products will have to be shipped.
Great. Well, I'm gonna ask Ann Petrie if we have any more questions coming in from our audience.
And it was out of the frame, but no, we have no more questions. How about for our Zoom participants? Hearing none, I think we can conclude.
Okay, well, this concludes the Voice of Business podcast brought to you by the Hancock Chamber of Commerce, together with the City of Diamondhead and Memorial Hospital at Gulfport, and now at Diamondhead through our
Yes.
expansion that we just talked about. And if you know someone who missed this broadcast today, they can actually see this podcast on Apple, Google, and Spotify. And let's just be reminded that City Hall and Diamondhead will be the spot for COVID vaccinations on September 15th and October 7th. So please help us spread the word about that opportunity for our citizens. Mayor Depreo, thank you so much for being our guest host today. You did a great job. We're gonna have to get you back because there are so many exciting things happening in Diamondhead right now. I know you told me the other day that you were going to try to seek some funding for the dog park that we've been hearing so much about.
Yes, we are. We've been working hard on that. And I did receive some great news about the dog park this week on the funding. So we're ready to move forward. We are starting the mayor's youth council. So that's going to be a very exciting event for grades 9 through 12. We're working on a skate park, a pump track, our new business district. We're working on a new road coming in there. We're upgrading our existing business district, and I could go on and on. Things are happening in Diamondhead. We're hot, we're popping, we're where it's at, and we're very thankful to Memorial Hospital for investing in Diamondhead and look forward to working together for many, many years.
Thank you.
And Tish,
Thank
a shout out to you and the chamber. Many things in Hancock County happen because of the hard work that you do. And we greatly appreciate everything the chamber does for our community and moving it forward. Y'all are our key to the catalyst of what comes into Hancock County, and we want to thank you for that.
Thank you, Mayor. We're going to get you back to get an update on all the great things happening in Diamondhead, in addition to what's happening here with Memorial. So thank you. And you heard it here on the Voice of Business podcast.